It's lovely to see so many of you. My name's Ashley Flores. I'm the Director of Infection Control at King's Hospital in London. And I've been asked to share our experience of running a Gloves Off campaign in our trust and some of the challenges and opportunities around the implementation of sustainability in healthcare. So there will be some time at the end for questions. Before I start, I would like to acknowledge Countess of Chester Hospital, Great Ormond Street Hospital and Guy's and St Thomas's Trust, because we share the same sustainability team. So some of our ideas obviously were intermingled across both of our trusts. And I've found other infection control teams very generous in sharing their ideas, which is what we're here to do. So this graphic is from Lim et al. In 2024. Just looking at all the opportunities there are in healthcare for sustainable projects. So obviously infection control potentially could have a big influence on this because we can drive a lot of the changes that are required to have more sustainable healthcare. The obvious one is personal protective equipment, all the plastic that we are recommending that healthcare staff use, single-use wipes, putting pressure on suppliers to have plastic-free versions of single-use wipes for decontamination of equipment and the environment. So this is just demonstrating all of the different opportunities. I think often I find that colleagues think that infection control are obstacles to sustainability because sometimes we say no. But obviously our role is to keep the patient safe. And depending on how old you are, I'm definitely old enough to remember, for example, blood-stained laryngoscope handles that may have contributed now and then to hepatitis B, cross-infection. We have to keep staff safe at work. We have to keep our patients safe. And maybe some of the younger generation now don't remember those decontamination incidents that happened. So we definitely have, obviously, our patient safety hat on when we're looking at these different ideas. I had an anaesthetist come to see me last week. He wants to reuse syringes. He wants to go back to reusable laryngoscope blades and handles. And I'm just thinking, oh my God. Reusing syringes. But it's an opportunity, isn't it, for us as infection control practitioners to look at, well, what is achievable, what can we do for patient safety, but still meet the needs of sustainability. I think we're unfairly labelled as blockers in some of the sustainability projects because we, as humans, want to save our planet too, and those of us that have children and grandchildren want to got the same motivation as anyone else in healthcare. So I think we can all work together. So key areas of focus then, reusable equipment. So we now have inhaler recycling. We haven't looked at reusable curtains as yet, but that's another opportunity to look at. We are at the planning stage of reusable theatre linen. I mean, all of this does have to be balanced with the cost of the transport of removing theatre drapes, for example, them going through a washing process, then a sterilisation process, the cost of doing all of that work, and then the transport back to the hospital. Is it really more sustainable? So I guess it's balancing up all of these different influencing factors. And we have recyclable sharps on one of our sites, not the whole trust, but on our main site we have recyclable sharps. We can look at waste reduction, so we've now removed disposable couch rolls in our trust, apart from teams who felt they really needed it, so sexual health clinics, some gynae and maternity clinics where there might be, obviously blood, and they wanted to keep their disposable couch rolls. But for the rest of the trust, we've removed the couch rolls. It does depend, though, doesn't it, on good decontamination practices, which is another big issue because we know that healthcare staff don't always wash and decontaminate equipment effectively. So it's a big challenge with these projects, and the worry in the back of our minds as infection control practitioners, yes, we can do this, but are they really going to clean the couch between every single patient properly? So it's all of this balancing of risk factors. So there is an opportunity, isn't there, with our procurement colleagues to put pressure on suppliers to come up with more sustainable products. I know that there's a lot more available now than there was. And with our estates department and facilities team in what our housekeepers and domestics are doing. We already had microfiber cloths that the domestics are using, which they're washing, although we still use disposable cloth in our high-risk areas such as critical care and neonatal unit. And we have our clinical practice changes, so our Gloves Off project, which I'm talking about today, campaigns like IV to oral switch, and optimising waste streams. So I think that IV to oral switch is a very underestimated project that we should all be doing more. There are massive gains to have in terms of sustainability, using less plastic for intravenous antibiotics. But not only sustainability, but also nurses' time. So on this graphic, it took 22 minutes to make an IV medication, where it takes 80 seconds to give an oral antibiotic. So just on that alone, saving nurses' time, sustainability, it'd be worth doing more IV to oral switch projects, I think. Also, it allows us to take cannulas out earlier. That's reducing the risk of IV-related infection. We can just get them off IV antibiotics, take out the cannula, less risk of C. diff and less risk of Lyme-related bloodstream infections. So for me, this is all win-win. I don't know about your trust, but we often only have 1 or 2 antibiotic pharmacists, 1 microbiologist that's in charge of AMS. So antimicrobial stewardship projects are very, very under-resourced, I would say. So this, for our trust, is in its early stages. There has been some work, but we're still finding that 30% of our patients, when we audit it, could be on oral, but they're still on IV antibiotics. So for me, this is the biggest next thing that we could do for sustainability in our trust. So moving on to the Gloves Off campaign then. Before COVID, and before we had even heard the word sustainability, infection control teams knew that staff were overusing gloves. They were using them at the wrong times and wearing them for prolonged periods. So a lot of good work was done by Heather Loveday and our guru, Jenny Wilson, looking at observational studies, looking at the order in which staff put the gloves on, do the task, and how long they leave the gloves on after they've done the task. So obviously we've got the risk of inadvertent cross-infection from putting on gloves too early, touching lots of surfaces, and then taking them off way after they've finished the task, and then touching all those different surfaces. So there was already a lot of literature in infection control to say that we need to do some work to reduce the use of gloves in healthcare, even before we started to talk about sustainability. So for our project, we had really good engagement from some medical staff. Their primary focus was sustainability rather than infection control, but that's okay, as long as they're in the project and contributing to that, and they're very passionate and motivated about it. We had an excellent patient rep who was, I don't know if she was an oncology or hematology patient, but she was very vocal, very convincing, not scared to speak up to the execs about the project. So she really helped this project. She really was a great spokesperson for the patient experience in all of this. So if you can find a patient rep like that to help your projects, I would highly recommend that. Our procurement team helped us greatly with looking at glove use figures as part of our measurement plan. Obviously, our sustainability team, facilities, infection control colleagues, clinical staff, and our quality improvement team. So we used a quality improvement methodology for the project. So our aim was to reduce non-sterile gloves by 30%. So far, we've only achieved 6.9%, but we aimed high. It's still an ongoing project that we stopped over the winter, but we will restart it again this year. But I guess if we can keep going and building on that work, maybe eventually we can reach our 30% goal. So our measurement plan was to look at our glove use figures, to look at the financial savings. We did some observations of glove use practice, and obviously to estimate the carbon savings associated with the project. So this is our fishbone looking at why staff overuse gloves. Obviously, all of our policies and guidances on the intranet, buried in hand hygiene policies. Staff really don't have time to, in their busy day, looking on the intranet, looking for the page about when to wear gloves. So I think our policies are far less visible than we would like. And we think it's been the policy for years, but nobody seems to know it, but they're not that accessible. So I'm a fan of doing like policies on a page where you've just got one page of all the guidance on one page to make it easier for staff. I think the biggest area of our challenge is the culture change, so behaviour change with culture. So specifically when we spoke to porters, when you start talking about evidence-based practice, then nurses and doctors are very used to that, aren't they? They're used to us talking about risk assessment. You need gloves as part of your risk assessment for this task, but not this task. When it came to porters, my personal experience was that they didn't respond to that. They didn't respond to the evidence. They didn't particularly respond to the teaching. Maybe that's because I was rubbish at teaching, but I think it seemed to be they were saying, well, all the nurses are wearing gloves and all the doctors are wearing gloves and you're telling me not to wear gloves. So I think obviously the COVID pandemic has very much damaged this work, because at that point, infection control were saying wear gloves for absolutely every interaction with the patient, and now we're saying you don't have to. So I can see why it would be confusing to certain groups of staff who are not used to applying risk assessment to their behaviour. Definitely with the observations of practice, some staff looked like they were putting on gloves instead of washing their hands. Gloves are everywhere on the wards, aren't they? So it's just easier and quicker. Put a pair of gloves on, do the task, take them off, and then go on to the next patient. And in that way, they feel that they've protected themselves, and they think they've done the right thing. They're not deliberately trying to cause patient harm. So for me, education alone doesn't work, because education alone doesn't change attitudes and doesn't change the culture. So I think any campaign has to address a lot of different aspects of behaviour in healthcare, and not just do this because infection control said so. So the emotional aspects and cultural aspects and attitudes of staff definitely come into this in a big way. This is from Jenny Wilson. I find it quite interesting, this idea of fear and disgust in healthcare staff. So infection control has spent years and years telling staff, first it was universal precautions, now it's standard precautions, but we don't know what your patient's got. We haven't tested them for everything. They might have MRSA, whatever. They might have a bloodborne virus, so treat them all with standard precautions as if they might have those infections. So you can definitely see how that translates to healthcare staff thinking, oh my God, we don't know what this patient's got. They might have something and we don't know. Therefore, I'm going to wear gloves to protect myself. So I think there is an aspect of this feeling of fear and disgust towards patients, which for me is quite interesting, that psychology of how do we address that? How do we change staff behaviour when we're saying treat everyone the same as if they might have an infection, but don't wear gloves because you don't know they've got an infection. So I can see how infection control advice influences all of this in a kind of a negative way, because what we say changes depending on the circumstance, isn't it? So it's just interesting to me to think about how we ourselves as infection control practitioners influence all of this. And then there's a lot of role modelling and peer pressure, isn't there? That if you're a new staff member on a ward and everybody else is wearing gloves, then you're going to be wearing gloves as well. So once we'd had our QI meetings, all the members of the team came up with ideas. I really like that about quality improvement projects, that the ideas of the clinical staff or facility staff, they come up with their own ideas to change behaviour. So it's not infection control saying, top-down approach, we think you should do this everyone. It's actually ideas coming from the clinical staff themselves, or the porters and housekeepers, whatever the staff group might be. So we didn't do absolutely everything on this list. We piloted and PDSA'd some of the ideas and didn't continue with some of them. So for example, we wanted to do a visual display as a piece of art as part of Plastic Free July, but we didn't continue with that idea because we couldn't come up with a good enough sort of artistic display to do that. So we didn't do that one. We did do a quick reference guide, so all the guidance was on one page. We did some bolt-on training for domestics and porters, spoke to them about the campaign. We made some stickers and put them all on all the computers on wheels as a way to try and just raise awareness on the ward and involve some of the doctors in getting the message across. We didn't continue with that after the PDSA cycle because we didn't feel it was having any impact on behaviour. But I'll talk through some of these ideas that we did do. So we had our intranet page. So we printed and distributed the posters. We developed a poster for non-clinical staff and clinical staff. We had an email signature graphic. So we distributed these throughout the trust to try and raise awareness. Some nurses commented, well, patients want us to wear gloves because they feel safer. So we carried out a patient survey to see whether this was true or not. So this was our survey. This was done both online and on paper. So our patient rep went around a few areas with some paper questionnaires as well. So we had 40 responses. These are all adult patients. And we asked them, can you recall an occasion where a healthcare professional didn't wear gloves when you think they should have? And only 10% of patients said yes to that question. And then can you think of an occasion where a healthcare professional did wear gloves when you think they should not have? And 40% of patients thought that staff shouldn't have worn gloves for these examples. So helping them out of bed, talking to them, feeding patients, on ward rounds. So for me, this demonstrated quite a high level of knowledge for the patients themselves. They weren't all of them thinking, yes, you must wear gloves to touch me. There was a range of responses, obviously, but I think there was quite a good level of awareness with the patients in this survey. So I don't really think we can say patients want us to wear gloves, because I think it obviously will vary depending on the patient themselves, obviously. But I think we can't say that as a blanket approach to all patients as a reason to wear gloves. So some of the quotes from them, patients saying a lot of use in circumstances where I consider it unnecessary. It's only important if there's a risk of contamination, otherwise hand washing is fine. Healthcare professionals are human and forget to do the basics of washing hands. Gloves can offer reassurance to a patient, even if wrongly so. So I won't read out every single bit of this bar chart, but it's just to demonstrate that they didn't always agree that staff should wear gloves to touch them. And they did have an awareness of it depended on what task that the staff member was doing. One interesting area was haematology. So our haematology staff for years had been wearing gloves and aprons to enter every single patient room in haematology. So across the trust, we've got 5 haematology wards. They do bone marrow transplants. So these are very vulnerable patients, severely neutropenic, and a very highly motivated group of haematology staff who are obviously wanting to keep their patients safe and do the right thing for their patients. So it was quite a challenge to get them involved and to get them to change their glove and apron use. However, we had a very, very engaged haematologist who came to the QI meetings and got very involved in pushing this forward with our haematology team. So we had to have a lot of different meetings. The senior nursing staff, we got them to agree it. So they no longer automatically wear gloves and aprons just to walk into a haematology room. They will only wear them now if they're actually going to touch the patient, actually going to do some patient care. So all of those doctors that were previously standing on a ward round in a room with gloves and aprons on, not even touching the patient, are no longer doing that. So I think that was a big win, because they were very motivated to wear their gloves and aprons because of the vulnerability of their haematology patients. So we did a patient leaflet, so that, because haematology patients were used to staff wearing gloves even in outpatients, because they wear them the whole time in outpatients also. So we did a patient leaflet specifically for the haematology patients, so that they were aware of the campaign also. We did some bespoke posters and an evidence review to say, is there any evidence that they have to wear gloves and aprons the whole entire time in haematology? So when we're thinking about staff behaviour and ergonomics, there is an opportunity, isn't there, to design healthcare to make it easier for staff to do the right thing. That's quite challenging in glove use, or getting rid of gloves, because they still need gloves. So they still need to wear them sometimes, and it would still be appropriate for them to have gloves, in wards to wear at the appropriate times. So it's very difficult just to remove them and say you don't need them anymore. So a couple of things that we did do, though, acknowledgements to Great Ormond Street, because they did this years before we did this at King's, but we changed our drug administration policy and removed the need for gloves for drawing up IV medication, apart from cytotoxics and apart from liquid hormones. So as part of our policy, it's no longer necessary to wear gloves when you're drawing up IV medication, as long as you've decontaminated your hands before you start. So I think from an infection control point of view, this is a big win, because I think from the observational studies, when we looked at glove use in our healthcare staff, they were wearing the same gloves to prepare the medication, open the clinic door, get to the patient, possibly pull the curtains round, get the patient in the right position, and then give the medication with the same gloves on. So you're already using contaminated gloves when you get to the patient. And I know we're using non-touch technique, but you're still touching ports, aren't you, with contaminated gloves? And we know that the bacteria introduced can produce that biofilm and contribute to line-related infection. I wouldn't say we're 100% in this. I think some staff still probably do it. But we've changed the trust policy, and we're teaching that in all of our educational sessions, and still trying to raise awareness around this behaviour change. So our procurement team cut the glove use delivery to the wards by 5%. So this was an idea from the Countess of Chester Hospital, so we nicked that idea from them. But it just meant that if a ward had, 20 packets of gloves normally, they would have 5% less delivery. And nobody really noticed. So they did it. They cut the top up to every clinical area, and nobody really said anything about it. So I think there is an opportunity to reduce the top up on the wards for gloves as a way to try and reduce glove use and for sustainability purposes without them actually noticing too much if you do that. We did a gloves off video competition, which was fantastic. We had some really, really good entries, and it was a really positive story. We had a number of wards make videos about gloves off and submit them. We put them on our intranet site, and we used them as part of our Hand Hygiene Day last year on the 5th of May. So I think that was a fantastic idea. So our matron is there in the audience and on the on this picture. So yeah, that was it. And our matron was really key in that campaign. So that's a brilliant thing to do, doing a gloves off video campaign if you're looking for any other ideas. So this is some of our results. So Jack Steinberg is a critical care ward. Apologies if you can't see this very well. But over 10 months, Jack Steinberg used 182.4 thousand less gloves compared to before the campaign to after. Saved 4,742.4 kilograms of CO2 and reduced their spend by £6.5 thousand. And then this is our A&E ED department on the Denmark Hill site over the same period of 10 months. They used 153,000 less gloves, saved CO2 3,978 kilograms and reduced their spend by £8.5 thousand. So if this is replicated across the whole trust, you can see the financial benefits, the sustainability benefits, and also the infection control benefits that comes with reducing inappropriate glove use in healthcare. So moving on to the challenges of sustainability in infection control, we definitely have to balance the risk, don't we, especially around decontamination. So as I said at the beginning, we know that healthcare staff don't always decontaminate items appropriately. So when we are balancing the risk of doing a sustainability project and looking at decontamination guidance, we do have to be careful still, don't we? Are the staff going to clean those reusable bits of kit, or should we stick with disposables because it's safer for our patients? Sustained behaviour change is an issue. I think definitely for our Gloves Off project, you can see great results from that, but sustaining that is quite difficult because infection control teams are small. We're busy concentrating on all the other things that we have to concentrate on, so we can't keep just doing Gloves Off projects forever. So if you take the focus off it, behaviour can go back to how it was before. So I think sustaining the change is also a challenge with all of these projects. There is a challenge around increased waste. So God forbid we have another pandemic, but there was so much plastic used during COVID, wasn't there, that's been a real challenge for sustainability. And it has, I think, in the longer term, impacted on healthcare staff's behaviour as regards glove and apron use. It is high cost. If you are going to change from disposables to sending theatre linen away to another facility, pay somebody to wash it, pay for it to be autoclaved, and then pay for it to come back to the trust, that's very expensive. So sometimes the projects don't get off the ground just because it would be just too expensive to do that, and we end up using reusables anyway. So particularly for low to middle income countries, that's an issue. We can't always afford to do the sustainable way of a project. And then there is complex regulatory hurdles. So we are obliged to follow the manufacturer's instructions for decontamination if we're going to reprocess items of equipment. Some of the sterilisation methods might not be very environmental friendly. So there is a balance, isn't there, between what we're trying to do, the financial cost of it, and is it really more sustainable to do it that way rather than just using disposables? So it's all a balancing act. And there's also some lack of data and evidence as to which infection control sustainability projects have the biggest impact. But I think to end on a positive note, I think there's a lot of support. The Infection Prevention Society, as you're all aware, are very much promoting sustainability. Royal College of Surgeons, I think all the Royal Colleges are really supporting sustainability projects, and in the infection control world, we are embracing this. So I think there is opportunities to contribute to saving our environment whilst also balancing the patient safety aspects.